Let's see an NCLEX RN video based on care for patients with urinary disease. The lower urinary tract includes kidneys and ureters, bladder and ureters, bladder and urethra, kidneys and bladder. So here you need to know that kidneys and ureters are a part of upper urinary tract. So here the question is about the lower urinary tract and the answer is bladder and urethra. The patient is prescribed clean intermittent catheterization (CIC) for incontinence management. The nurse tells the patient that this will do what? Decrease urinary tract infection precipitated by retention of urine, re-establish control of urinary elimination, prevent frequent feeling of the need to void, decrease episodes of hematuria, cure incontinence. Clear intermittent catheterization or clean intermittent catheterization (CIC) will not decrease episodes of hematuria or cure incontinence. What it does is decrease urinary tract infection precipitated by retention of urine, re-establish control of the urinary elimination, and prevent frequent feeling of the need to void. The nurse understands that trial of passage is indicated in the patient who is febrile with gross hematuria, who has a 3 mm lower ureter stone without nausea vomiting, who is non-febrile with 6 mm lower ureter stone, who has a 3 mm lower ureter stone with nausea and vomiting. A trial of passage is indicated for small stones and also without nausea and vomiting. So who has a 3 mm lower ureter stone without nausea and vomiting. Motor stimulation of the bladder that mediates bladder contraction is provided by sympathetic nervous system, efferent innervation, parasympathetic nervous system, detrusor muscle. Bladder control is mediated by the interplay between the sympathetic and parasympathetic nervous systems. The parasympathetic system provides the stimulus for bladder contraction. The sympathetic nervous system mediates bladder storage. The detrusor muscle is found on the walls of the bladder and it relaxes or contracts based on nervous stimulation. Efferent innervation is in the process of carrying an impulse towards the intended muscle. This structure provides voluntary control of micturition. External sphincter, detrusor muscle, posterior urethral walls, internal sphincter. External sphincter is under voluntary control. The internal sphincter is involuntary. The detrusor muscle is found on the walls of the bladder. Posterior urethral valves are found in urethra to act as a valve to block the urine flow. The nurse recognizes which patient is at greatest risk for a UTI. A 35-year-old sexually active male, a 23-year-old sexually active female, a 50-year-old sexually active female, an 18-year-old sexually active male. Urinary tract infections are most common in women due to the close proximity of the urethra, vagina and rectum. They are also more common in young women, though maybe due to the honeymoon cystitis, which frequent sexual activity. They are less common in men due to the length of the urethra. So, the greatest risk for UTI is for a 23-year-old sexually active female. The nurse understands which population is at increased risk for developing urinary stones. Black female living in Florida, white males living in Georgia, black males living in New York, white females living in Oregon. Urolithiasis or urinary stones are most prevalent in Caucasians, males, and those living in warm and humid environment. So here it's Georgia. White males living in Georgia. Which statement by the patient indicates teaching about tamsulosin or Flomax have been effective? Will this medicine help my nausea? So this medicine will help me pass the stone by relaxing the muscles. I need to take this medicine so I don't get an infection. This medicine is for pain. Flomax is prescribed to relax the muscles to allow the stone to pass. It's not for pain, nausea or infection. So if the patient says, So this medicine will help me pass the stone by relaxing the muscle is the correct statement. The patient with stress incontinence is prescribed Kegel exercise. The nurse tells the patient that Kegel exercise will help strengthen the detrusor muscle, the posterior urethral wall, strengthen the internal sphincter, strengthen the external sphincter. Kegel exercise specifically strengthens the external sphincter muscles. The nurse understands that non-muscle cancers affect only muscle and surrounding fat, the urothelium or inner lining of the bladder, structures adjacent to the bladder, the lobes of the prostate. Non-muscle bladder cancer only affect the inner lining of the bladder. They have not involved the surrounding muscles, adjacent structures or the prostate. So here the urothelium or the inner lining of the bladder. Tom, a healthy 24-year-old sexually active female, presents with 3-day history of urinary frequency, dysuria and urgency. She denies fever, chills or vomiting but has mild nausea. She is married and mother of 1-year-old daughter. Her family history is significant of heart disease and kidney stones. Mild suprapubic tenderness is noted but no costovertebral angle tenderness, that is tenderness on the back in the area over the kidneys. Vital signs: temperature 98.9, pulse 75 beats per minute, respiration 18, BP 118 by 78 mmHg. Urinalysis reveals cloudy yellow urine. Urine dip shows too numerous to count white blood cells, small amount of red blood cells, positive nitrites and a small amount of bacteria and a large amount of bacteria. Urine culture results are positive for greater than 1 lakh E. coli, supporting the diagnosis of UTI. The bacteria are shown to be sensitive to Bactrim DS. She is prescribed a 7-day course of Bactrim DS, that is trimethoprim plus sulfa methoxazole. Additionally, Peridium is prescribed to alleviate discomfort from dysuria. She is encouraged to increase her water intake. She understands the importance of completing her antibiotics as prescribed to prevent bacterial resistance. She is encouraged to increase her fluid intake to flush her urine and to call her provider for fever or flank pain, or if her compliance or symptoms do not improve after completing the antibiotics. She is provided with education on how to prevent future UTIs, such as wiping front to back after using the toilet and urinating after sexual intercourse. Which statement by Tom regarding new flank pain indicates teaching has been effective? I will call the doctor for pain medicine if the flank pain comes back. Does new flank pain mean I might have an infection in my kidneys? New flank pain means the infection has spread to my gallbladder. This pain may mean the infection would involve my reproductive system. Calling the doctor is important if the pain comes back, but it is important to understand flank pain indicates the infection might have traveled to the upper urinary system, not to the gallbladder or reproductive system. So statement, does new flank pain mean I might have an infection in my kidneys, shows the teaching is effective. Which action by Tom indicates the need for further teaching about her prescribed medicine? Tom calls in panic because her urine is an orange color. Tom is scheduling her follow-up appointment even though her dysuria resolved with Peridium. Tom states her understanding that Peridium should be taken no more than 3 days. She reports her symptoms have improved but continues to take her Bactrim DS as prescribed. So here, further teaching is required when Tom calls in panic because her urine is orange colored. Peridium causes urine to turn orange or rust colored. All the other statements are correct. The nurse recognizes Tom's urinalysis as suspicious for a UTI by the presence of the following: ketones, WBC, bacteria, bilirubin, protein. White blood cells, bacteria and nitrates can be found in urine during a UTI. Ketones, bilirubin and protein do not indicate UTI. So here WBC and bacteria. Which statement are true regarding UTIs? Urinary tract infections are more common in women because of the close proximity of urethra, vagina and rectum. Sexual intercourse does not increase the risk for UTI. It's more common for males to develop a UTI because of the length of the urethra. Sexual intercourse increases the risk for a UTI. Flank pain is a symptom of lower UTIs. It is less common for males to develop UTI due to the length of the urethra. Flank pain is a symptom of upper urinary tract infections. Sexual intercourse does increase the risk of UTI. So here the correct statements are: UTI are more common in women because of close proximity of urethra, vagina and rectum. Sexual intercourse increases the risk for a UTI. The nurse understands which common signs indicate a lower UTI. Fever, dysuria, frequency, hematuria, nausea. Nausea and fever are signs of upper urinary tract infection. So the other symptoms like dysuria, frequency and hematuria, they are common in lower urinary tract infection. Hope you understood this video. Thank you so much for watching. Please do keep watching.